Hey, welcome back to my PA notes, and hopefully in this video we're going to make one of the trickiest topic, dermatology, simple and manageable. Over the next couple of minutes we're going to break down the must-know dermatology concept that you should know as a PA, which can help you for your exam but also in your real practice as a physician associate. Plus, I will give you some mnemonics and exam tips along the way to make sure you remember all the key details. However, before we jump in, make sure you subscribe to the channel if you have already done so, and check out my website mypanotes.co.uk for free flashcard, exam notes and many study resources to help you crush the nationals. Okay, let's start with atopic dermatitis, or what most people call eczema. If you're preparing for the nationals, eczema is one of those bread and butter conditions that you must know inside and out. It's super common, especially in children. But don't forget, it's not limited to children. You can see that in adults too. So what exactly is eczema? Well, it's a chronic inflammatory skin condition, which means it keeps coming back and forth and can flare up under certain triggers. Clinically, it's characterized by dry, scaly, itchy patches of skin. Now, think about patients who can't stop scratching, especially around the elbow, the knees, and the flexural regions, maybe around the ears and creases of their arms. And when that happens, and they can't stop scratching, the skin becomes thickened and may even start forming crust in severe cases. Let's make this easier to remember with a mnemonic, okay? The one I use is HITCH. I'm going to break it down for you. So I stand for irritation, which is a constant itchy that makes the patient feel quite miserable. T for thickened skin. This happens when the eczema has been around for a while, so you get a thickening of the skin. C stands for crusting. This is what happens when you see it in severe and infected cases. Bear in mind, you can have infected eczema too, but that's another topic. And finally, H for hyperpigmentation. You can get those dark patches of skin after the inflammation has pretty much subsidized, unfortunately. So how do we treat it? Well, first focus on moisturizers or emollients to keep the skin hydrated. Then the next step is to use topical corticosteroid, which are your go-to for reducing inflammation during the flare-ups. And in severe cases, through dermatologists, they may use like immunomodulators like tacrolimus, something like that. But I think that's a bit too much details for you to know for the national exams. Next up is psoriasis. Well, this is another big hitter in the national exam and clinical practice. So you might want to step back. You might want to grab a seat. Now, if eczema is all about itchy skin, psoriasis is all about scaly plaques. So what is psoriasis? Well, it is an autoimmune condition, which means your immune system is mistakenly attacking your own skin. This causes the skin cell to turn over way too quickly. For example, in a normal person, skin cells take about a month to regenerate. In someone with psoriasis, this takes about 3 to 4 days. Talk about overworking and pay more taxes. Anyway, and that rapid cell turnover creates those silvery, scaly patches of skin, which is the hallmark of this condition. Now, psoriasis usually appear on the extensor surfaces, like knees, the elbow again, and some lower back. Also lower back, that's what happens sometimes. But it's not just about the skin. You may also find some nail changes for some reason, like pitting or separation of the nail from the nail bed. And this condition is called onycholysis. My damn thing. Now, here's the mnemonic to remember psoriasis. Guess what? Plaques. Nice and easy. Okay. P stands for pitting of the nails, which we just explained. L stands for lesions, which is the scaly red plaques. A for spit sign. If you gently scrape the scale, it bleeds. That's what it means. Yeah, just keep that in mind. Q for quick skin turnover, which we just explained, 3 to 4 days. U for underlying redness. E for extensor surfaces, like we said, elbow, knees, and lower back. And S for scales, which is the silvery, flaky scales. Nice and easy. Now, treatment. In terms of treatment, we're looking at topical corticosteroid, phototherapy for extensive cases, and in severe cases, where you need to use things like methotrexate or biologics. So, it's all about controlling the immune response and slowing that crazy skin cell turnover. Now, if you want to dive deeper into the treatment, where do you go? mypanotes.co.uk. Moving on to the next condition, which is acne. Now, it's something that most of us or some of us might have experienced as we got older over the teenage years. But it's not just about teenagers, okay? It can affect people well into their adulthood. But for the purpose of the exam, it's important for us to understand the different type of acne and how we should manage it. At its core, acne is all about blocked hair follicles and inflammation of the sebaceous gland. So, we are talking about comedones, which are your whiteheads and your blackheads. Then you've got your papules, your pustules, and more severe cases, the cyst itself. Here's the thing. Acne management follows a stepwise approach based on severity. For example, in mild acne, we start with like a topical agent like benzoyl peroxide or retinoids. And for moderate acne, we add an oral antibiotic on top of the topical to reduce that inflammation process. And in the severe cases, you tend to use isotretinoin, which are a powerful drug, but have some really serious side effects. So patient needs regular follow-ups. That's why we tend to refer them to dermatologists at that point. But patient will really fight you for that. Keep an eye on that. Okay. Now let's move and talk about urticaria. What most people call is hives. This is an allergic skin reaction that causes red, itchy, raised welts or wheals, which come and go quite rapidly. This is often triggered by food, medication, or even stress. The key here is that these wheals usually disappear within 24 hours, but they can come back, so bear that in mind. Now, here's a simple mnemonic to remember about urticaria. Fast. Just like stroke, but anyway, different topic. F food, like shellfish, peanuts, and other common allergens. A for allergies. This include like drug like NSAID or antibiotic penicillin. S for stress, like we mentioned, which can happen to any individual when they're under pressure. T for temperature. Both cold and heat can trigger hives, so just bear that in mind. Okay, now treatment is quite straightforward. It's almost always usually antihistamine to block this release of histamine and counter the allergic reaction. But in more severe chronic cases, we tend to use corticosteroids, but that is under the dermatologist's advice. Let's talk about emergencies. This is where you really need to pay attention for the national exam. Stevens-Johnson syndrome, SJS. This is a life-threatening condition. You cannot miss it. It always occurs, it tends to occur after drug reaction to maybe NSAID, penicillin, antibiotics, anticonvulsants, and so forth. So what's happening here? The patient developed blisters and erosion all over the skin. And these affect the mucous membrane of the eyes, the mouths, and even genitalia. These patients are super sick, so they need to be admitted to the hospital, probably in ICU. So, here's the mnemonic: stop. S for severe drug reaction. T for toxic epidermal necrolysis, which is worse than SJS. Look it up on my website. O for oral involvement. You see ulcers in your mouth. P for positive, Nikolsky sign, where the skin basically is slut off when rubbed gently. It's just peeling, guys. So that's a life-threatening stuff. Do not miss it. So what is the treatment in this case? Well, it's all about stopping the offending drug immediately and supporting the patient with fluid, wound care. But like I said, this is a medical emergency, so it needs an MDT team of different people ensure this patient is safe. If you found this video helpful, make sure you put a thumbs up, subscribe to my channel, and share with your fellow student, colleague, friends, enemy, dogs, whatever you got. And don't forget to head to my website, my PO Notes. The link will be on the description below, where you can find some really good resources that hopefully will match your needs. And I will see you guys in the next video.